So why it's beneficial to work directly with an agency? I'd say because we get enlisted by our customers. You know, when they have thousands and thousands of applicants that come through every single month, it's difficult to funnel through and find that needle in the haystack. And so what we always tell folks when we're talking to them is they can get direct access within 24, 48 hours to the hiring manager. So we don't discourage them from obviously working with the hospitals they want to, but a lot of times we can get them direct access in a fashion that makes sense for them, and it's quicker in a lot of cases as well. So it's usually a win-win for both sides.
A lot of times candidates ask our recruiters, does it cost money to work with squad builders? Absolutely not if you're a candidate. That's one of the best things about being a recruiter is we truly get to connect people with their dream jobs. At the end of the day, our customers are the healthcare organizations that we work with. So we serve them, and we also serve healthcare professionals at the same time. So we're compensated by our customers, and that's how we stay in business. But our core mission is to serve our healthcare organizations and so serve healthcare professionals. And basically, we connect good people with good jobs, and we don't charge anything to candidates.
Squad Builders pays you, the nurse, because you are a Squad Builders employee, and you'll be our employee for the 13-week contract. So you get paid every 2 weeks.
When you work through Squad Builders, whether you're working at a hospital or a nursing home or a clinic, you're basically just like any other team member that works at that clinic or hospital or nursing home, wherever it may be. A lot of times we tell people the only difference between you and any other person who may be on staff permanently is that your paycheck comes from Squad Builders.
So depending on what kind of contract you're working with the customer, it can be a 13-week temp to perm, it could be a 13-week just straight up contract. What we always encourage folks to do is get with your recruiter as soon as possible. In a lot of cases, we're looking at maybe a halfway point from maybe that 6-7 week to kind of get a feel for what you're looking to do. If you're looking to extend the contract, go on a new contract, but a lot of cases, your demand is there, and we want to get you shifted over to a new contract if that's your desire. If you want to extend or even go permanently with the customer, we encourage you to get with us as soon as possible so we can start to move these things around with the customer and yourself and make sure that all the parts are there, that it's a win-win-win for everybody.
Your hours and pay are guaranteed. It is given to you under a written contract, so that will include all of the details of your assignment as far as schedule, pay, all of the good details will be written out ahead of time.
So once you sign an agreement, which is our very simple offer letter that locks you into the assignment and guarantees your assignment. Obviously, there's a few things in there like, hey, you have to pass a background check, you have to pass a simple pre-employment drug screen, things like that. But there are very few cases where a person doesn't meet all of the pre-employment required compliance to be able to move forward with the position. But very good question that a lot of people ask.
Squad Builders offers a full benefit package including medical, dental, vision, and a supplemental life policy.
We cover half of the premium for medical and dental for the employee, and vision and basic life are at a zero cost to you.
There are some very, very good healthcare organizations that we work with locally in the Kansas City area. It is the largest amount of our customers. We work with some fantastic world-class healthcare organizations, everything from level 1 trauma teaching hospitals to interurban level 1 trauma centers, all the way down to level 2, level 3, even level 4 trauma centers to rural and regional healthcare centers in the greater Kansas City area, spanning all the way over to Topeka and Manhattan. But we also work with organizations in Texas, up north in Wisconsin. We work with many partners regionally.
Yeah, that's a good question as far as orientation is concerned. Our customers want to see success, obviously. They've put time and energy into the relationship with yourself. And so when it comes to orientation, a lot of times you're going to get some computer training up front. You're going to get some education on the customer as well. And then you're going to work into unit orientation as well. And that's where you get the nuts and bolts of the unit. That's where you really understand who you're working with. And you get to ask the really good questions about how the unit works, what the expectations are. So you'll absolutely get orientation, and we wouldn't expect anything less.
Great thing about working contract is that the pay is typically higher. With that, it varies depending on the specialty and the unit that you are working on, along with facility. But great thing, pay is usually higher, and some great pay rates are offered with that. Thank you.